Hello everybody. Today's video, as promised, is about colds in toddlers all the way through teens. If you have a tiny baby with a cold, see the previous video. So first let's define what a cold is. We call this viral upper respiratory infections or viral URIs. And it's important to remember it's viral because some parents mistakenly think if they could get an antibiotic for their child, it would quicken the cure somehow, and that's just not the case. The infection can be severe, but it's still viral. And so if you go to your pediatrician and go home without an antibiotic, don't feel like you lost that battle. That's what's best for your child. A virus actually infects inside the cell. An antibiotic can only kill a bacterial infection. Bacteria live outside the cell. And to overuse antibiotics is only dangerous for your child and can create resistant organisms, yeast infections, diarrhea because it kills the beneficial bacteria in the gut. So even though viruses can be severe, it doesn't mean that the antibiotics will help them any. So for viral upper respiratory infections or colds, we expect for the symptoms to last up to 2 weeks. And they can include clear runny nose, thick cloudy runny nose, nasal congestion, cough, sore throat, just generally feeling tired and achy and yucky. But again, it doesn't mean antibiotics will make them any better. Now, in the baby video, we had talked about some supportive care measures you could use just to help with your child's symptoms, to help them feel better as their immune system fights this cold off. To give their immune system strength, you need to encourage rest, and you definitely need to encourage a lot of fluids. You can expect for the appetite to be poor, that's common, but even with the poor appetite for solid foods, you have to force the liquids. That's what's so important. And the best way to monitor their hydration is to make sure they're having good urine output throughout this. A lot of people focus on wet diapers in infants, but even in older kids, it's important to know their urine output. And so even an older child should still have to pee at least 3 times every 24 hours or at least once every 8 hours. And that's really important to keep track of, even in the big kids. Now, I want to teach you something about fevers and colds. Colds are infections, obviously, so they could cause a fever to begin with. Most of the time they're low grade, but occasionally can be pretty high, even 102 or 103 at the beginning of the cold. But what should happen is the fever itself should decrease over the first several days and typically won't last more than 3 to 4 days. Then the cold symptoms persist. Now, the cold can last for up to 2 weeks total of the congestion and drainage, and sometimes the cough can even last 3 weeks. Even after the nose and the nasal symptoms have cleared, the cough can persist for another week afterwards. But what we worry about is if the fever is resolved, the cold symptoms persist, and then all of a sudden the fever returns or spikes up. Most of the time that means that there is a secondary bacterial infection. If you've gotten to the 2-week mark of persistent nasal symptoms, that secondary infection could be a bacterial sinusitis, or your child could have developed a pneumonia or an ear infection. So certainly if you've noted that pattern, fever resolved, came back later, you probably need to be seen just to give your pediatrician's office a call and bring that child in for an evaluation. I also want to teach you tonight to be a savvy reader of labels of medication. So let's do a quick rundown. For infants under 12 months, they can only have nasal saline, elevate the head, the humidifier, push fluids, and that sort of thing that we talked about in the previous video. Now, beginning at 12 months, babies can receive honey to help with the cough. You can certainly try some warm fluids. You can even sweeten those warm fluids with honey, and that same trick really works throughout all the ages. Now, babies can receive a plain antihistamine, such as Benadryl, down to the age of 6 months. Now, let me teach you. There is sort of a gray zone. Up till age 2, we absolutely do not want cough suppressants or decongestants. At the very, very most, with your pediatrician's permission, you can use the antihistamines. Now, in the 2 to 6-year-old zone, it's sort of murky. The issue is, while the use of these medicines may not be dangerous, most likely the child won't respond to them either. They just don't seem to be beneficial. So I still usually just stick with the Benadryl, a straight antihistamine, and the supportive care measures like the humidifier. Now what's really neat is there have been studies done in the use of Vicks Vapor Rub and honey from 2 to 6, and they were both found to be actually effective. So they're not just homeopathic, they're demonstrated in controlled trials to be helpful. So I would recommend you use Vicks Vapor Rub on the chest. Now everyone asks me about putting it on the feet. with socks at night, and that's perfectly fine and totally harmless. I just don't have a specific study to quote to tell you that that works, that I'm aware of anyway, but it was studied with applying it on the chest. So you can do both perfectly fine. And even older kids, you can still prop their heads up at night when they're sleeping. You can run the cool mist humidifier. You can try a steamy shower. So from 2 to 6, you can also still use Tylenol and Motrin and alternate them if needed to control fever or just discomfort or complaints of pain. Now, after 6, you can try decongestants. That would be something that would on the label read pseudoephedrine or Sudafed, phenylephrine. You can also try cough suppressants like dextromethorphan. So for the older children, there are a lot of combination products available, and these are now safe to try. But what I want you to do is read the label, even for adults. I know a lot of people who take Tylenol PM to help them fall asleep. And that really doesn't make a lot of sense when they could get generic Tylenol and generic Benadryl called diphenhydramine. And if their only concern was needing assistance falling asleep, there's no need to take the extra Tylenol. Just take the plain diphenhydramine and don't waste potential side effects of unnecessary medication. So it's the same with children's cough and cold medicine. If you have a specific symptom you're trying to treat, you can look for that when you're buying your medication. In general, antihistamines can be more sedating, so they're great for bedtime, and decongestants can keep you awake, so they're not great for bedtime because you want the child to be able to sleep. Now, this is easy to remember if you look at the ingredients of, and generic is fine, Dayquil and NyQuil. So you need to base the dosage of medications on weight, roughly, and most of the medicines over the counter will have an age range for you to go by. Once a child's over about 100 pounds, so some of the older teens, you can usually get away with adult dosing of medication once they're over 12 and over 100 pounds. And one of the easiest tricks in the world to me is, for myself and my own kids, is to do a dose of Benadryl and ibuprofen together at bedtime to help with fever, discomfort. The ibuprofen lasts longer than the Tylenol, and the Benadryl helps with the postnasal drainage because it decreases some of that mucus production, and it's that postnasal mucousy drainage that triggers a lot of nighttime cough. So for an older child, I try to teach them something called mucus management. So that means for all this yucky mucus that the cold's making in your body, I want you to try to get rid of it. So drink a lot of fluids, extra fluids. Drink so much that when you pee, your pee-pee looks like water, and then you'll know you're very well hydrated. And the reason I encourage you to do that, several things. When you're creating this mucus, if you're very well hydrated, the mucus will be thinner and not so thick and viscous, so it'll be easier to get rid of it, hopefully. Also, just the very act of drinking is going to rinse out some of that mucousy postnasal drainage that's triggering all the nighttime cough. So drink extra fluids. Be sure to cough up and spit out any mucus that you can. And when your nose is full, do not be a sniffer-upper, be a blower-outer. Get the mucus out of there. It's very important. So encourage your kids to blow and not sniff up. Every time they sniff, they're encouraging headache, facial pressure, postnasal drainage, more cough. So they'll feel much better if they can just get rid of it. You can also encourage them to take a steamy shower, and that moisture will break up the mucus a little bit. You can encourage them to drink warm fluids with the honey mixed in because the warm fluids are mucolytic. They break up the mucus in the back of the throat, and the honey coats and soothes the throat to help them not to have quite so much cough. So elevate the head, run the humidifier, steamy showers, Vicks Vapor Rub, honey in hot tea, a dose of Benadryl at bedtime, or for the older kids, you could even go all out and do the Dayquil and the NyQuil, or for yourself, for adults. I do want to mention one thing. Be a savvy label reader. If there is a decongestant in your combination product, and if your child is on a stimulant medicine for ADHD, you're really not supposed to give those at the very same time. You could use it once the ADHD meds wore off, maybe in mid-afternoon, but during the daytime you wouldn't want to use them together because they could both theoretically increase blood pressure, and you don't want to add the chances of that together. Also, we need to make sure that we try to limit the spread of these cold viruses in the wintertime. So I want you to try to teach your child, wash your hands carefully after blowing your nose. Try to learn to cough into your elbow. So you won't cough into your hands and then touch doorknobs and spread the germs everywhere. So we want to try to have some good hygiene measures and good hand washing skills. Hand sanitizer probably is good enough for most viral upper respiratory infections, but is often not good enough for the vomiting and diarrhea bug, the stomach bug. So with that, you need running water, warm, with soap for at least 20 seconds. So encourage your kids to have careful hand washing, keep some Kleenexes with them. They can use cough drops if they're old enough to not choke on them. And they're allowed to return to school once they've had no fever for 24 hours. But of course, play that by ear. If they wake up in the morning and they need to go to school, but they're exhausted and they didn't sleep well last night from coughing, maybe it's not such a good idea to go that day. So you have to play that by ear depending on how they're doing. But definitely, please don't send them when they're still febrile, because they're even more contagious at that point. These infections are spread in respiratory droplets. So when they sneeze and cough, that's when they're scattering out all these germs to spread to other kids. So be very careful at that stage. And I think that's about everything I was going to cover. Again, please, if you have comments, you can list them under this video and I'll try to answer them in future videos. And thanks for watching.